There are hundreds of thousands of heart surgeries every year. But in the 1940s, this was simply not the case. The medical world collectively deemed that this organ was too fragile to be operated on, and any surgeon who attempted such a procedure would promptly lose their reputation. However, Dr. Alfred Blalock, Dr. Helen Taussig, and a Carpenter would work together and bend these rules to create a newfound branch of medicine, cardiac surgery. Oh, and yes, I did say Carpenter. In this lesson, we'll be concentrating on the Carpenter's more than impressive achievements, despite being an African American in a hostile and racist world. His name was Vivien Thomas. Now, Vivien was not rich. When the Great Depression hit, he had to give up his dreams of attending college and was instead hired as a surgical research assistant under Dr. Alfred Blalock at Vanderbilt University in Tennessee. Thomas was at first tasked with preparing dogs so that Dr. Blalock could operate on them. However, Blalock immediately recognized his steady hands and cutting precision and knew that Thomas would have great potential. Just a few weeks later, Vivien had learned anatomy, physiology, and surgical techniques. Soon, he was performing these procedures on his own, while Dr. Blalock was busy in the operating room. Together, Blalock and Thomas researched traumatic injuries, concluding that these deaths were the result of excessive blood loss and crush syndrome. These World War II-era discoveries led to the concept of blood transfusions, which would ultimately save thousands of soldiers' lives on the battlefield. Despite Vivien's advanced medical prowess, his official title was janitor, since it was unconventional at the time to have an African-American lab assistant. Even worse, he was paid a janitor's salary. With the stock market crash and a low income, Vivien struggled to make ends meet and was forced to work multiple jobs. One of these jobs was bartender, which created the awkward situation in which during the evening, he was serving the very people he taught during the day. Blalock and Thomas's research brought Blalock many new job opportunities. For example, he was offered a job in Detroit, but had to decline, since Detroit would not allow an African American like Vivien to serve on his team. Later, when Blalock was invited to become the surgery chairman at Johns Hopkins, he successfully negotiated that he and Thomas were a package deal. Although Thomas was a Hopkins employee, he faced lots of discrimination, as he was the only African American at Johns Hopkins not working as a janitor. Forced to enter through the back door of the building, Thomas garnered negative attention with his white lab coat, and eventually just opted to wear street clothes whenever he was outside the lab. At Hopkins, Blalock and Thomas continued their research with dogs as models. Soon, they were approached by Dr. Helen Taussig, who was desperately searching for a cure for tetralogy of Fallot, a heart condition some babies are born with, which leads to cyanosis, cyan meaning blue and osis meaning the condition of. This condition is also known as blue baby syndrome. Thomas and Blalock soon realized that their prior research at Vanderbilt could serve as a potential fix for this blueness. So Thomas performed and perfected this operation on over 200 dogs to prove that this operation was non-lethal. However, many fellow doctors warned Blalock that should this procedure go sideways, it would strip him of his reputation. Blalock persisted anyways. Despite Thomas being the one with the well-practiced skills for this particular surgery, Blalock was the first to operate on a child suffering from tetralogy of Fallot. This is because non-doctors were not allowed to operate on patients, and it was very difficult for African Americans like Vivien to earn medical degrees at the time. Nevertheless, Vivien perched upon a step stool behind Blalock and guided him through the entire operation after Blalock insisted that Thomas be present. The surgery was a success. Blue turned to pink before their eyes. Blalock's gamble on his reputation won big, and soon his face was plastered over prominent medical journals from across the world. Blalock and Taussig received credit for the operation, now called the BT shunt or Blalock-Taussig shunt, while Vivien was never mentioned. Soon, the halls of Johns Hopkins were crowded with blue babies and their families in the hopes that they would be cured. In the next 6 years, Blalock and his team went on to perform another 1,000 BT shunts. Besides his groundbreaking work with Blalock, Thomas went on to tutor young Hopkins surgeons, many of whom went on to become world famous. In his final years, Thomas began to get the recognition that was long overdue. Thomas received an honorary doctorate from Johns Hopkins in 1976, and his portrait now hangs across from Blalock's in the medical school. Today, the Vivien T. Thomas Medical Arts Academy and the Thomas Pediatric and Congenital Heart Center bear his name. Thomas was a pioneer in cardiac surgery. So for Black History Month, we'd like you to help spread his story. Miss Andrea Kalin started a Change.org petition to the United States Postal Service to get a commemorative Vivien Thomas stamp made. As of now, the petition only needs another 250 signatures, and your signature can help Vivien Thomas and his contributions be remembered for generations to come. And when you're done with that, get ready to dive into exactly what is Tetralogy of Fallot in the next mission. See you there! Do you ever wonder why you breathe? It's because the cells that you are made up of require oxygen, and to get the oxygen to them in a timely manner, you have your heart. Now, your heart is essentially two pumps. The right one pushes blood into your lungs, where special cells, called red blood cells, are filled up with the oxygen that you breathe in. After returning to the heart, the left pump pushes this fresh, red blood all across your body through arteries. As it returns to the veins and heart, the oxygen is used up and the blood turns darker or bluer. Sometimes, babies can have a heart defect, which leads to blue baby syndrome. One such defect, Tetralogy of Fallot, is caused by a blockage that prevents blue blood from reaching the lungs. Also, a hole allows some of this blue blood to mix with some red blood, which prevents the body from receiving enough oxygen. Eventually, extended periods of oxygen deprivation can lead to death. When Dr. Taussig originally reached out to Dr. Blaylock, she asked him if he could help the blue babies by rerouting the blood supply, like a plumber reroutes pipes. Using this 3D printed model of a heart, I'll show you what he and Thomas did. Before I show you Tetralogy of Fallot in this heart, I'm going to show you normal blood flow. So first, blue blood, or deoxygenated blood, comes in through these vessels and into the right atrium, which is this area. And then it goes into the right ventricle, and it's then pumped through here into this vessel I've painted purple. And from here, it goes out and into the lungs, which you have on either side of your heart. And from there, it's reoxygenated, it turns red again, and comes in through these vessels on the sides of this chamber, called the left atrium. From the left atrium, it'll go down into the left ventricle. And from the left ventricle, it comes out the top at the aorta, where it enters the rest of your body until it comes back in a loop and returns here as blue blood again. Now, in Tetralogy of Fallot, babies often have a blockage right here, which prevents blood from getting here or here into the lungs. And in addition to that blockage, they also have a hole behind it, which allows this blue, unoxygenated blood to just skip going to the lungs and just come out the aorta into your body. Now, to get more blood flow to the lungs, what Blaylock, Thomas, and Taussig did was they took this blood vessel here that would eventually be going to the arms, they severed it, and then they instead connected it right here at this purple vessel. What that does is it leads this blood that would be going out to the body back into here, which goes out into the lungs. That way, the blood is reoxygenated and the babies get enough blood, and then they turn from blue to pink. While this surgery does not correct the defect, the blockage and the hole are still here, and this is really just a workaround, it did give their blue babies the chance to live longer. However, this surgery was the first of its kind and proved that kids could survive a heart surgery. Over the next 50 years, and with new technology, we would develop new methods that allow us to actually go into the heart and fix this defect directly.